I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to go over what is sciatica. This is something we treat a lot of, and we do a lot of back pain and sciatica workshops because we see a lot of this. It's a prevalent issue. Those of you who have winter sports kids, wrestling, swimming, like myself, I've spent all weekend on a pool deck. A lot of people have spent all weekend standing in the stands. So we had a lot of flare-ups today on sciatica and low back pain. So what is sciatica? Because there's a lot of information out there on the internet and it can get very confusing. I understand that. And some of it is correct, some of it's not correct. Well, should you be concerned? Is it something to worry about? What do you do? So we're going to go through those things right now. If you have pain in your back or going down your leg, then we can give you a free consultation with a doctor of physical therapy. All you have to do is call our office at 215-997-9898, and we'll be happy to set that up for you. But what is sciatica? Sciatica is what I like to call a garbage can term. It just means pain going down the leg. So it doesn't mean that there's not anything wrong with you. It doesn't mean that there's not a specific cause, but when we talk about sciatica, there's a sciatic nerve, and there's usually some sort of pain associated with that. It usually just means pain going down the leg. But what does it mean to have sciatica? So that's where the challenging part comes in, because when you have sciatica, you may have several different causes of pain going down your leg. So while we get a diagnosis of sciatica or we diagnose ourselves with sciatica, it doesn't necessarily mean one specific thing. And then you have pain going down your leg. So you can have pain from a herniated disc. You could have numbness and tingling going down your leg from a disc that is bulging or herniated, and that could be causing your sciatica. You could have sciatica from a tight muscle, either in your low back or all the way into your butt. Piriformis syndrome is something that can cause numbness and tingling or pain going down your leg. So what is important when you understand sciatica is, and this is where a lot of people get frustrated and read a lot of misinformation on the internet, is just because you have pain going down your leg and it's called sciatica, or somebody diagnosed you with sciatica, or you diagnosed yourself with sciatica, doesn't mean that's what you have. Doesn't mean that the person who's giving you the information or the misinformation about their bout with sciatica is the same as what you have. So really be careful when you are looking up sciatica and researching sciatica, that you understand that understanding where and why you have sciatica is really important, which is one of the reasons we do offer those free consultations with a doctor of physical therapy. And if you want one, all you have to do is call our office at 215-997-9898. We will certainly set you up with that. But it is important that you understand where that comes from, because understanding that is how you actually treat it. It does not mean you need surgery. There's a lot out there, if you Google sciatica, on how there was a surgery and then the surgery went wrong, and it really sends people down this panic-stricken road. Unfortunately, that's not the majority of the cases, and people avoid getting treatment and avoid getting treatment sooner because they're so worried about what can happen. They're so worried about the fact that it may lead to surgery. But in fact, most of sciatica can be treated without surgery, without a lot of medication either, without pain injections. So getting to the root of the cause and getting to the root of the cause early is the key to treating any sort of back pain or sciatica. Usually when it comes to sciatica, it means that there's several things going on. We need to address all of them in order to improve your daily living. So it's important that you get that addressed immediately. Sciatica generally never starts as you woke up one morning with pain going down your leg and now it doesn't stop. Back pain and sciatica generally start with an incident. It happened years ago and you laid down for a day and it went away. And then all of a sudden it came back another year, maybe last year it came back, and now all of a sudden it came back 6 months ago. Sciatica comes usually with over time. So you get little hints that there is going to be an issue. You get little hints that there's pain. You might get a pain in your butt one day and you kind of sit down, or you just take a rest, or you stop running, or you stop doing activities, and it goes away. And then all of a sudden that pain now goes from your butt down into your leg. This is the progression of sciatica. It doesn't usually start automatically going all the way down into your toes. It usually starts starting a little bit higher up, or it starts in a more progressive manner. It starts in a manner that you can handle. It starts in a manner that you ignore. It starts in a manner that you take Advil to get rid of. So it is important to understand that the sooner you treat a sciatica symptom and a sciatica diagnosis, the easier it's going to be. The less likely it is that you're going to need surgery or you're going to need medication. And most, like I said, most of the times that's not even necessary. When you're dealing with sciatica, you're dealing with pain going down your leg. This is concerning because pain going down your leg can lead to muscle involvement, can lead to foot drop, can lead to muscle issues. So it's not something that you want to ignore. It's not something you want to shake off. I am the queen of sleep it off. I am the queen of, we'll look at it later. I tell my kids that all the time based on their symptoms. But for this, when you start to have pain that goes down your leg or numbness and tingling, sometimes it doesn't have to involve numbness and tingling. It can just be a sharp shooting pain down the back of your thigh, down the front of your thigh, into your groin. That's an issue. That's something you want to have addressed because you need to figure out where is it coming from. Most of the time it's coming from several different places. You could have stenosis, you could have arthritis, you could have degenerative disc disease, all these different things that people get freaked out when they read on the internet. In reality, most of them are very treatable very quickly, and if you address them soon enough, you're actually able to, I don't want to say reverse the effects, but you're able to control the symptoms, and you're able to control exactly what's going on. Most people are going to be diagnosed with back pain in their life, 80% of Americans, but you are going to have to figure out where it comes from very quickly, and if you do, and if you actually address it, and you change some habits, it's going to go away, and you won't have to worry about those medications and that surgery. So one of the things that you can do with sciatica, which is pain going down your leg, and one of the exercises you can do is you can just put your hands on your back, and all you're going to do is look up at the ceiling, okay? Nice and easy, just lean back. Now this may irritate you and this may cause more pain going down your leg, which again is why you want someone to actually look at this and diagnose this more than just an x-ray. X-ray is not really going to show everything that's going on. MRI will show it a little bit more, but you do want somebody to actually get their hands on you, check out the muscle quality. Is there muscle imbalances? Is there weakness? Which is a lot of the reason that you get sciatica in the first place is because of this muscle imbalance, because this muscle issues going on. So it is important that you have somebody take a look and make sure why you're actually having it, why you're getting that pain. So, but this is a very simple exercise to do if you are getting that. This is going to help reset the discs. One of the things that you do want to also consider when you're looking at your sciatica treatment, and whether you're seeking it professionally or you're seeking it at your own house, is there is a hands-on component that needs to happen. It's really not something that you can get away with curing, quote unquote, without having somebody work on your muscles, without having somebody look at your muscles, without correcting some muscle imbalances. A lot of time what happens is we get so what we call anterior tilted in our pelvis. So if you see a lot of people with their butt kind of sticking out, that's a muscle imbalance created by the pelvis or happening at the pelvis. So you need to correct that. So one of the things that you also can do is you can start by bending your knees slightly, okay, and tucking your pelvis under. So you're able to have a better posture. Sciatica, pain going down your leg, back pain, a lot of it is driven by poor posture, and it's not just sitting at your desk posture, it's standing posture. So in order to get rid of that, you want to make sure that you are changing positions every 15 minutes, whether it's just going from a quick sit to a stand, whether you're going to sit down for a second, whether you're you're not going to wear flats, you're going to wear sneakers, or you're not going to wear high heels, you're going to wear flats. So paying attention to the surface and how long you're on a surface is important also when dealing with sciatica, because it's going to change the muscles, it's going to change the joints, the ligaments, and how the discs react. So paying attention to your posture, you're standing and sitting, lying down, all the above plays a big part in back pain. That's why I said, changing habits and changing posture habits or changing habits that you do during your week is so important, because without that, it doesn't matter how much therapy you have or how many injections you have or what surgery you have. If you don't change how you live your life, it's going to happen again. So you may have had surgery, it may have gone away, you may have had surgery and it didn't work. And that's the reason it didn't work, is because there was no change of your body position throughout the day. You didn't work on your posture, nothing got corrected. So it's really important that when you're dealing with pain going down your leg, when you're dealing with any sort of issues when it comes to your back pain, you want to make sure that you are, in fact, changing habits, changing how you sleep, changing how you sit and things like that, changing your desk. Super important. Final thing we're going to show you is one of my favorite stretches. We do this on all of our videos, and it's one of the stretches I do every day, so I don't ever always feel bad showing it to you. It's just the pigeon stretch, the figure 4 stretch, however you want to call it. It's this stretch here where you're going to put your leg up on a table. You can do this laying down. You can do this sitting. This is going to help open up your hips and your low back. All you're going to do is take your leg up on the table. Now, some of you may be up here when you put your leg up on the table. That's okay. All you want to do is, if it's here, that's fine. This is where you start. If it's flat, that's fine too. You want to stand up nice and straight, and then you want to lean forward. You want to stop when you feel a stretch. Okay? You're going to feel a stretch either in your glute, in your hamstring, in your back. Stop when you feel a stretch. What you don't want to do is you don't want to do this. Okay? You're actually causing some herniations in your spine as we speak when you do that. So you want to, again, it's hinging from the hips, coming forward, nice and easy. You're going to feel that stretch in that leg that's up on the table. If you're sitting down, your ankles cross. It's a very easy stretch to do, especially in a meeting. If you're stuck sitting for a while, you can just kind of prop your leg up, do this figure 4 stretch, sit up nice and straight, and bend forward. No one will even know you're doing anything. You want to hold that for about 30 seconds, 6 times, and then switch sides. Do that as often as you can throughout the day. That's going to help loosen that hip and back up. If you are experiencing back pain, we actually are offering a back pain and sciatica seminar. I will post the link in the video so that way you are able to go and sign up. It is free, and we will teach you more exercise and what you can do to help alleviate the back pain and sciatica. Thank you and have a good night.